Good evening. My name is Michelle Comp. I work for Thomasville Medical Center in Thomasville, North Carolina. There, I am their stroke and chest pain coordinator. I graduated from A&T in 2014 and have 9 years of bedside nursing experience. I worked in such departments as step-down, correctional nursing, and I worked in the emergency department during the COVID pandemic. I also have experience in traveling to Virginia and South Carolina and working in their hospitals. Tonight I'm going to speak with you concerning an issue surrounding the medical field, which is workplace violence directed at medical personnel by patients. H.R. 1195, Workplace Violence Prevention for Healthcare and Social Service Workers Act, was presented and introduced on February 22nd, 2021 by Representative Joe Courtney from Connecticut. The bill would aim to protect employees from workplace violence. It would do so by utilizing OSHA, who would regulate the plans and policies surrounding workplace violence towards medical staff, which would then be facilitated to the facilities and they would implement the new plans. I have several experiences with being assaulted by patients. I have been kicked, slapped, hit, bodily fluids thrown on me, and assaulted in other ways by patients, and so many others in the medical field have been so as well. According to a Press Ganey report in the second quarter of 2022, more than 5,200 medical personnel have been assaulted by patients, which is approximately 57 assaults per day. This is assaults on providers, nurses, CNAs, respiratory, speech, occupational health, CT techs. No one in the medical field is safe from patients these days. One organization that supports this bill is the American Public Health Association. They cite an increase in workplace violence since the COVID pandemic. Unfortunately, the American Hospital Association does not support the bill, stating prohibitive costs due to COVID as their main reason for opposing this bill. Unfortunately, this is another example of putting profit before people. As I have stated previously, I have been assaulted several times by patients, and so have many of my staff and coworkers. Please consider taking a closer look at Bill H.R. 1195, Workplace Violence Prevention for Healthcare and Social Service Workers Act. This bill was passed in the House on April 16, 2021, and is waiting to be approved and set into a law by the Senate. Thank you for helping me shine a light on this very important issue, which is workplace violence against medical staff by patients, and Bill H.R. 1195, Workplace Violence Prevention for Healthcare and Social Service Workers Act. I appreciate your time and your consideration and attention towards this bill. Thank you very much.